So a broad spectrum of potential application through the use of hypoxic conditioning. So hypoxic conditioning here is in the middle, so there is a continuum between normoxia and really severe hypoxia and the pattern of hypoxic exposure, right? If you're exposed to mild hypoxia continuously, sustained moderate hypoxia, you might have very limited beneficial effect. At the other side of the spectrum, if you're exposed to really severe hypoxia and from the permanent pattern, that might also be deleterious, right? But in between, if you're exposed to hypoxia intermittently at moderate hypoxia, there is a window here, what we call hypoxic conditioning, where you might have some optimal gains. And this is what we need to define, you know, what is the best practice to be exposed, what will be the severity of hypoxia, what will be the number of exposure, what will be the duration of the exposure cycle, the cyclical variation. This is what we are still unsure. So the evidence is showing that those protocols involving a very severe hypoxic condition, like less than 10%, that was done in animal, right? Like you're not going to expose humans to 2% of oxygen, obviously, but when the exposure pattern is very severe and when you have a lot of like on and off period, it seems that it's what is described here in red, it's negative. So it's negative in terms of inflammation markers and all this kind of thing. On the other side, if the exposure is moderate, somewhere between 10 to 13%, if the number of cycle is between 10 and 15, I would say, yes, that's what we describe the low dose hypoxic conditioning. So we will be in this zone here, right, between 9 and 12% of oxygen with a cycle number like 10 to 15. Then we're gonna get some positive adaptation. So it's important to realize that yes, it depends on the dose, right, like the severity and also the cyclical number of exposure. It can be positive or it can become negative, right? So we need to play with that to try to prescribe what would be the best exposure. So this is where we try to do some work. I have a PhD student in London, South Bank University. He worked with obese patients and he wanted to explore what's the effect of cyclical variation. So what he did, he compared different cycles, what he called the short cycle, medium and long. So the short one was 2-minute exposure to hypoxia, 2-minute rest, 2-minute exposure, 2-minute rest. The medium was 3 and 3, and the long one was 6 minutes, 6 minutes. So it was 1 hour exposure, so it means that the subject total, they were exposed to 30 minutes of hypoxia, 30 minutes of normoxia. That was matched, and the severity of hypoxia was